I'm Dr. G, and we're here with Engaging Minds. Every week, we like to look at our world from a deeper and more psychological point of view. And as a clinical psychologist, one topic that interests me a great deal is the topic of relationships and how that interconnects with sometimes issues like addiction and issues like love and how they all interact. And this is a special time, too, because I know we've all just celebrated Easter and Passover, and Easter and Passover are very much about new beginnings. And in relationships, we're always looking for that inspiration for a new beginning, and we're going to explore this topic. Our first guest is Dr. Cassidy Blair. She's a clinical psychologist and owner of the Blair Wellness Group. Cassidy, I want to welcome you to the show.
Thank you, Dr. G. Appreciate it. It's very nice to be here.
It's a pleasure having you on. So I wanted to talk to you, since we've all dealt with relationships, I wanted to let you introduce yourself a little bit to our audience, to our listeners. Tell them about your first thoughts when I said, hey, you guys, do you want to come on a show and talk about love, relationships, and other addictions? And think, well, what came up for you when you thought of that? Dr. Cassidy Blair is a fellow psychologist. I'm wondering what her initial thoughts were around the relationship between love, relationships, and other addictions.
That happens to be a very passionate subject to me, actually, Dr. Goss, because it is something that most people do not take as seriously when it comes to relationships. They think that relationships do not have an impact on addiction, and if they are healthy or not, it doesn't have an impact on their lives, but it does. And the society actually validates a lot of times about being in a relationship, and if you have the volatile relationship, perhaps is part of what society has accepted, but actually it's not, because once it's not healthy, it could be very much what makes the addiction worse and actually gets people to really embark upon substance and other addictive behaviors. So it is something I'm quite passionate about.
One of the big issues when someone usually comes in at the beginning is there's so many issues of shame about feeling, like they failed or they are in the place they're at. And going out there and speaking like you do really helps alleviate a lot of that shame and turn something that possibly is very negative into something that is actually can be very empowering in your life. Wouldn't you agree, Dr. Blair?
Absolutely. It's very true. And because of the shame and the guilt they feel, oftentimes they can't be themselves. They can't really be open and upfront about stuff. So That's quite important.
We love honesty, and that's why we're going to take a break. I'm Dr. G. We're going to be back right after the commercials. I am Dr. Glass, and we're back with the show. Before we start our show, I want to mention that tonight we're lucky to have one of our sponsors on the show, Dr. Cassidy Blair. She's with Blair Wellness Group. Blair Wellness Group provides comprehensive psychological services and quality care to high-level clients in an exclusive setting. They're located in Beverly Hills. Dr. Blair is a licensed psychologist, and she helps clients navigate stress management, depression, anxiety, and addiction issues. Her services include performance coaching, relationship counseling, and trauma and recovery. Did I miss anything, Dr. Blair? Since
no,
you're right
you're
here.
always great. On point as always.
I felt odd mentioning. I felt like I was talking for you, and you're sitting right here.
I love that. You can always do that. I trust you fully.
And for more information, you can contact Dr. Blair at 310-999-4996 or visit BlairWellnessGroup.com. Again, that number is 310-999-4996. So one of the addictions that's a little controversial, it depends who you're talking to, is this concept of love addiction. Some people believe it can be addiction, others don't. But the idea is that people, if I have this right, people fall in love in a romantic way and they don't see the real relationship for what it is. And they tend to go from relationship to relationship, not dealing with their personal issues, and use the relationship and love as a way of masking what they're dealing with. I know Dr. Blair has a very specific opinion about this.
For someone who really gets attracted to someone else, it's all about you numbing yourself to fill a void, an actually hole inside, and try to distract yourself, like the problems and issues you never dealt with. And as you pointed out, it's always, always invariably about childhood issues and traumas that you were never able to resolve. So the problem for a love addict is that they always try to control and focus on controlling someone else's life and their behavior and actions. And as we know, there's no such thing as controlling anyone else. It's just controlling your own reactions to another person. But a love addict uses exactly another human being and relationship the very same way as they use drugs, alcohol, substance, gambling. And the very thing that I always talk to my clients when they come in for intensive treatment of any substance or alcohol is that you cannot date, you cannot have sex, you cannot drink, you cannot use drugs, gamble, or travel, because all of those, or go on a shopping spree. So I have these billionaire clients. Sometimes they actually make joke about, you all actually are going to control how much I spend. I said, well, for you, I give you a couple of thousand. That is okay. That's your budget. Anything more than that, you're numbing. Someone who is what you think going to be the answer to all your issues and problems, she's going to be the gateway into actually you relapsing.
Mm-hmm. Well, I think what happens is, behavior takes a long time to change, and you're just gonna keep acting out that same behavioral cycle with other people or other 100%. Substances or whatever. So having a good break for a year and focusing on yourself, then hopefully when you go back into relationships, I'm just thinking, like, there's a client I'm dealing with right now who, apart from being a substance abuse problem, was a sex addict and hasn't had sex in a couple years. He hasn't, and is really terrified of, we're talking a lot about having sex again because it's so associated with drugs. He's just not sure if he's going to be able to do it, but yet he wants to do it. So it's going to be a little bit of a slippery slope, but the good thing is now he has all the support and all this work behind him that he has places to go with it. I want to bring on Dan. He's a caller, and he has a great question. So first of all, let me welcome Dan to the show. Dan, this is Dr. G. It's a pleasure to have you on.
It's mainly about my wife. She's been drinking a lot lately. When we first met, she didn't really drink that much, but it seems like in social situations, she tends to drink, and just because she doesn't feel comfortable around other people, she says that she kind of feels disconnected when she's around people, and she can't be her true self. And so she drinks, has a drink here and a drink there, but it's getting more and more and more. And I kind of almost sympathize with her. I mean, she is kind of really kind of nervous around other people, but I'm wondering, is there like some other kind of medication she can take that she can be on, an antidepressant or something that would help her feel that connection so that she feels, comfortable and around other people, and so she doesn't have to turn to alcohol to get that feeling?
And one of the questions people always ask, and I'll ask Dr. Blair to address this, is people ask, well, do I have an addiction or am I a social drinker? You can go by the strict guidelines, but how would you define that?
So actually, I want to address what Dan asked a bit earlier. So first of all, sorry about what's going on with your wife, but obviously you can consult with a psychiatrist and with an internal medicine for medication. However, in my belief, absent of intentional, intensive intervention, any disease can only get progressively worse. So while we can do a Band-Aid perhaps with medication, then the actual issue would always remain unresolved, because once you take the medication away, then the person still can go back to where they were, to the baseline they were. So you need to really take into consideration, do you really want permanency and permanent resolution of these issues? So without, again, intentional, intensive intervention, there is no such thing as, in my opinion at least, magically waking up one day and not having those issues. Every time I go into any social setting, I'm not into drinking or drugs, never been. And so I have to sometimes actually humor people, sadly enough, because they ask me, are you a recovering alcoholic?
No, you know what? I like that because I've actually done that. I remember last year I had a business meeting and all the guys that were there, who were all men, they were all English. So everyone was drinking like 10 o'clock in the morning and having Bloody Marys. And it was that same sense of I didn't want them to feel uncomfortable because it was a business meeting.
Sure.
I excused myself and said I'm going to the bathroom, and I went to the bartender and said, make mine a virgin. And came back. Dan, I hope we've been able to answer your question and give you a little bit of insight into what your wife is dealing with. I want to go to our panel, have them introduce themselves a little more formally, and then we're going to talk about the concept of how to have a healthy relationship, what their opinion is around that. So I'm going to start with Dr. Blair. Dr. Blair, if people want to get in touch with you, how could they do so?
They can call 310-999-4996.
That's right, I have it right here.
That's true. Or they can visit the website, which is blairwellnessgroup.com.
What should people look for when they're dating?
Boundaries,
or in a relationship.
and boundaries, actually.
Okay.
So it's pretty much based on trust, respect, honesty, communication that is transparent. So you say what you mean and you mean what you say without being afraid of the consequences for being honest, and having true respect for each other's space, mind, thoughts, belief system. But I also think that people can truly last together when they have shared belief and shared vision. If they don't, then it's going to be pretty much very difficult to really make it work.
Yeah.
If you're not on the same page and you're not working as a team and having convictions about what's right and doing the right thing, I don't see how successful people can be. So you have a lot to overcome.
No, I like that. Actually, I just thought of a metaphor when we were talking earlier on about love addiction.
Yeah.
That love addiction is like a sprint and a real relationship is like a marathon.
Sure.
Can you write that down? My next book. I've just shared it with thousands of people. We can't trademark it.